But moving on, with just about 9 days left for the union budget, a lot of speculations are being made on the healthcare sector. My colleague Haripriya had a conversation with the people of Bangalore and asked them what are their expectations in the sector. Let's listen into what she has to say.
We are in one of Bengaluru's busiest area, Indiranagar, and we are speaking with people here to understand their budget expectations related to the healthcare sector. Ma'am, tell us, there's an upcoming budget coming up, so what are the expectations from the government? Where do you think there can be more improvements made?
As per the healthcare domain, what I generally feel is there should be more subsidized rates for, normal general public, you can keep one rate, but at least for specially abled, disabled people, there should be more subsidized rate is what I expect. And more infrastructural, changes should be made. I guess the budget is allotted, but I don't know on what level is it, being implemented and reached out to the general public. So, yeah.
This causes problems.
Yes, it does. It does cause a lot of problem, especially, if there was some, quicker methods, to get the treatment to the specially abled kids, it would be really helpful. Not only kids, the people who are specially abled, especially because I am here in front of an hospital. One of my cousin is inside. She is specially a disabled child. She doesn't have the patience to wait, right, to get the treatment. So I feel there should be some, sort of improvements on that part. Not people, most of them, they do not have the knowledge about what are the facilities that are, that these people can avail, right? And insurance claim is one more thing which I would like to emphasize for these kids, right? You need to produce so many documents, right? They have a specially abled kid card also is there, right? Isn't that enough to, get the insurance claimed and the bills are insufficient? I don't know. That process should be a little bit, faster and more transparency should be there. And that is what I feel.
What do you think the government can do better? Is there any problem in the implementations that you've seen?
One of the schemes, that is Ayushman Bharat Yojana, that has been implemented in 2018 to be precise. They say first to begin with the Ayushman Bharat Yojana card that is available or accessible to people. There is lack of awareness as to how to even make the card to begin with. Second thing is it says it covers 5 lakhs per family every year, irrespective of gender, age, and it's not only for senior citizens. But they say that there are so many empaneled hospitals. Step into any of the corporate hospitals in Bangalore, let's say public or private, they say that there's no funding that is available. And and there's no person to help as well. You step into the insurance desk, right, in any of the hospitals. They say sometimes they're not aware themselves that there is some scheme like this exists.
So they say the funding from the government has not come?
They say we are not aware of it. There is no funding that has come. That is especially like aided hospital or like a lower. For example, my parents are old, and when we were getting my father treated for oncology, none of them were aware of the schemes that was there. They said none of this exists. We can't help. If you have insurance, please step in. Otherwise, no. Corporate hospital is a corporate hospital at the end of the day. There's no specific person assigned at the desk to say this, from government or a third party to say there is this scheme that you can use for family. It's a family floater. But those things are not available. So I think if it is implemented, if there are empaneled hospitals, the list should be available as to which area, where we can go. There should be a point of contact that we can access, and the cards should be made easier, maybe in Bangalore one and things like that. More focus on that and more awareness on the scheme in itself would be helpful.
ಏನು ನಿಮ್ಮದು ಬೇಡಿಕೆ ಇದೆ ಬಜೆಟಿಂದ? ನಿಮಗೆ ಏನು ಅನ್ಸುತ್ತೆ, ಎಲ್ಲೆಲ್ಲೇ ತೊಂದರೆ ಇದೆ?
ಸೇಮ್ ಅದು ಆಯುಷ್ಮಾನ್ ಭಾರತ್ ಬಗ್ಗೆನೇ. ಆಯುಷ್ಮಾನ್ ಭಾರತ್ ಸೆಂಟ್ರಲ್ ಗೌರ್ಮೆಂಟಿಂದ ಒಳ್ಳೆ ಸ್ಕೀಮ್ ಇದೆ, ಬಟ್ ಜನರಿಗೆ ಅವೇರ್ನೆಸ್ ಇಲ್ಲ. ಆ್ಯಂಡ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಹಾಸ್ಪಿಟಲ್ಗಳಲ್ಲಿ ಕರೆಕ್ಟಾಗಿ ರೆಸ್ಪಾಂಡ್ ಮಾಡಲ್ಲ, ಜನರಿಗೆ ಟ್ರೀಟ್ಮೆಂಟ್ ಬಗ್ಗೆ ಇನ್ಫಾರ್ಮೇಷನ್ ಕೊಡಲ್ಲ. ಯಾವುದೇ ಕೆಲವೊಂದು ಎಕ್ಸ್ಕ್ಲೂಷನ್, ಈ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲ, ಆ ಟ್ರೀಟ್ಮೆಂಟ್ ಇಲ್ಲ ಅಂತ ತುಂಬ ಈವೊಂದು ಅದರಲ್ಲಿ ವೆಬ್ಸೈಟ್ನಲ್ಲಿ ಇಫ್ ದೇ ಹ್ಯಾವ್ ಶೋಡ್ ಆಲ್ಸೋ ಟ್ರೀಟ್ಮೆಂಟ್ ಈಸ್ ಇನ್ಕ್ಲೂಡ್, ಬಟ್ ಮೋಸ್ಟ್ ಆಫ್ ದ ಹಾಸ್ಪಿಟಲ್ಸ್ ಈವಂತು ಫಾರ್ ಗೌರ್ಮೆಂಟ್ ಹಾಸ್ಪಿಟಲ್ಸ್ಲೇ ಡಿನೈ ಮಾಡ್ತಾರೆ ಟ್ರೀಟ್ಮೆಂಟಿಗೆ. ಅದು ನಮಗೆ ಬರಲ್ಲ ಇದು, ಅಥವಾ ಫಂಡಿಂಗ್ ಇಲ್ಲ, ಅವ್ರು ಹೇಳಿದಾಗೆ ಫಂಡಿಂಗ್ ಇಲ್ಲ ಅಂತ ಹೇಳಿದೆ ಏನೋ ಒಂದು ರೀಸನ್ಗಳು ಹೇಳಿ ಅನ್ನೆಸೆಸರಿಲಿ ಪೇಷಂಟ್ಸಿಗೆ ಇದು ಮಾಡ್ತಾರೆ. ಆ್ಯಂಡ್ ಅವೇರ್ನೆಸ್ ಡೆಫಿನೆಟ್ಲಿ ಅವ್ರು ಹೇಳಿದಾಗೆ ಅವೇರ್ನೆಸ್ ಕೂಡ ಇಂಪ್ರೂವ್ ಆಗಬೇಕು. Definitely, that's budget-nally more allocation should be given to healthcare sector in terms of, as Madam said, for senior citizens, for disabled people, they should be get more benefited from the healthcare schemes.